Celebrating 10 years of research, education, and outreach. Women often are treated as small men when it comes to health and wellness. Scientific research on women lags far behind studies on men, leading to inaccurate and sometimes ineffective treatment. But in late 2007, 3 people joined forces to ensure that health is individually inspired. Texas Tech University Chancellor Kent Hance, First Lady Laura Bush, and Dr. Marjorie Jenkins planned the internationally known Institute of Today.
I'm honored that you've named this institute for me, and I'm proud of the very important work you do every day to save women's lives.
The Laura W. Bush Institute for Women's Health began at Texas Tech University's Health Sciences Center in Amarillo. Its mission: to raise millions of dollars to support medical research on sex and gender science and women's health, to educate healthcare providers, and to help tens of thousands of women through community outreach. 10 years later, that work now is carried out not only in Amarillo, but also Abilene, Corpus Christi, Dallas, Fort Worth, Lubbock, Midland, Odessa, and San Angelo. There is no research discovery that will save a patient's life unless it first traverses a learning environment. Dr. Marjorie Jenkins. Research must lead to action.
One of the things that we're really excited about is that our Laura Bush Institute is putting together for us a gender-specific curriculum.
Our sex and gender-based health program is being used by medical schools, nursing, and pharmacy schools nationwide. It is open to anyone interested in updates on women's health and disseminating information about important sex and gender differences. Perhaps the most visible area of impact today is the Institute's outreach within communities that educates and empowers women. We bring expert information and advice to women across Texas on vital topics that highlight sex and gender differences. At our signature events, we invite celebrities to share personal stories that touch our hearts and unite us in a shared experience. We inspire middle school girls and college students across Texas with messages of personal safety, anti-bullying, good nutrition, and empowerment through events like Girl Power and Girls Night Out. We support Dr. Thomas Hale and Dr. Teresa Baker at the Infant Risk Center, where pregnant women and breastfeeding moms get reliable advice on medications that are safe for mother and baby. 8,000 uninsured women have been screened for breast and cervical cancer in the Concho Valley and High Plains through grants. 132 cancers have been found, and these women are being treated. We support Dr. Rakshanda Rahman at the Breast Center of Excellence, where new techniques such as cryoablation are being used to treat breast cancer in the Texas Panhandle.
Cryoablation is a technique where you can freeze a tumor and not have to operate because the tumor will be killed due to the temperature difference.
Thanks to the generosity and leadership from our National Advisory Board, the Institute has become a leader in women's health, as well as sex and gender differences in Texas and across the nation.
Generally speaking, taking one product and spreading it to this wide an area without an entity like the Laura Bush Institute would take not 1 decade, it would take a lot of decades to get there.
The Laura W. Bush Institute for Women's Health sincerely thanks President Ted Mitchell and the Texas Tech University Health Sciences Center, which underwrites 80% of operations so that your donations can be applied to our mission. The Laura W. Bush Institute for Women's Health. Health, individually inspired.